There's another myth they have people normally they say time heals it all, or heals all wound. Oh, just leave it, give it some time. The pain will go. Don't go to the dentist. Once you go, they'll remove your teeth. Okay. So does that time really heals it all?
Time heals all wound except dental wound. we give exception to that because a cavity that is just starting.
Okay.
You say, oh, it will heal with time. No, that cavity is going to get wider and wider. Tooth is the most patient thing, but when the pain comes, the pain is as bad as the pain of childbirth.
Oh.
Yes, only childbirth pain can be compared to dental pain in real sense. So time will not heal that cavity. Rather, time will make it worse. A cavity that is just small, 2 millimeter wide, in the next 4 years, it becomes as wide as 10 millimeter. So 10 millimeter from a size of a tooth, you know that tooth is gone. So it's advisable to, the white man will say a stitch in time saves nine. So you should save that tooth by early intervention.
Okay.
So, and you will not know when the cavity is there. So early regular checks is also necessary. Because when the cavity is just starting, you will not know because it's not painful. Okay. It's the dentist that will put the camera in your mouth and show you or tell you, you have a cavity here, let's fix it before it becomes, it goes out of hand.
Okay.
Yes, time will not heal a dental wound.
Then again, you mentioned something about dental pain being, synonymous to pregnant and labor pain.
Mm-hmm.
But there is this myth that pregnant mothers should avoid dentists at all costs.
It's advisable to do your scaling and polishing dental works before pregnancy comes.
Okay, so it's not a myth at all.
It's not a myth.
So pregnant mothers should avoid.
You can still see the dentist, you can still see the dental hygienist in pregnancy. Scaling and polishing can be done in pregnancy. Why? Because in pregnancy, yes, in pregnancy, because in pregnancy,
you lie supine.
No, you're not really lying down. You are sitting down, inclined.
Inclined.
Yes.
Okay.
So it's just the positioning and the length of the procedure that discourages people. But what we'll do is, when you're pregnant, especially when you're heavily pregnant, you will break the procedure into 2 or 3 visits.
Okay.
And secondly, during pregnancy, hormonal changes will cause the bleeding gum to be exaggerated.
Wow.
Any plaque in your mouth will be exaggerated. So it's expected that you should clean regularly. But forgive me, most pregnant people, especially the first trimester, don't like brushing.
Why?
Especially those that have
they're having nausea.
Nausea, money signs. It will just be throwing up anyhow. So they don't want to throw up. Attempt to brush your tongue. You want to throw up at every time. Every food enters your mouth.
So how do they clean their teeth?
That is why you are supposed to see the dentist before you get pregnant, or when immediately you notice that you are pregnant. Every cavity should be filled at that time, because when you do extraction for a pregnant woman, you can't give her the post-op medication that is necessary for pain control. So you restrict the post-op medication because of the pregnancy. So that may prolong the healing time. Okay, so that is why it is always advisable at the early stage of pregnancy, visit the dentist, do your cleanup, and any cavity that needs to be fixed should be fixed. Okay, not when it is advanced pregnancy, or we'll just tell the person, wait after pregnancy before you do some advanced procedure like surgical extractions.
What can you tell our people, for example, pregnant women that are in their first trimester, that are having nausea, early morning, sickness, they're always throwing up. What do you have to tell them? What other alternative that can they have to brushing their teeth? If brushing their teeth stimulates,
they should still brush. When such person sees a dentist, a proper history is taken, and after the proper history, we'll know which type of brush the person should use
to reduce the nausea,
the effect of the stimulus that causes the vomit.
So please make we try and take good care of our teeth. Best Life Health is here to help you to improve on your health and improve on your health seeking habit. We are here to help you to make the right decision that will help to impact your life positively. Without wasting much time, we'd like to thank our special guest today.
It's a pleasure.
Dr. Jerryton, thank you for coming.
Thank you for having me.
We appreciate your time.
Thank you so much.
And appreciate the topic of discussion. You really try to
No,
break it down.
it's inexhaustive. There are a lot to talk
There are a
about.
lot that, like,
Confidentiality.
yeah, like I said, there'll be another time.
Okay.
There'll be another
I'll
time.
be glad to be here.
There'll be another time. So thank you so much.